Hi, it's Sandy Wyllie. Welcome to my mental health channel, where I wipe away the stigma of mental illness by talking about my own personal struggles with borderline personality disorder and post-traumatic stress disorder as well. I talk about bipolar, narcissism, childhood traumas, abuse, schizophrenia, depression, anxiety, and a plethora of other mental health related topics. But I only come on as a former patient of almost 20 years. I am not a licensed therapist. I do not hold a degree in psychology, so I cannot give you a diagnosis or a professional opinion. I can only share with you my almost 20 years of being a patient, a former patient. And all I ask of you in return is your kindness and respect, please, in the comments. Please be kind and respectful to me, to other people who comment. We don't have to agree on everything, but we do need to agree on being respectful and kind. Now, if you are new to my channel, welcome, welcome. You can hit that subscribe button on the right because it's 100% free, and that will notify you in the future when I have videos that come out. You'll get a little notification of that. If you like what you see, go ahead and hit that like button on the left so I know which videos you want more of that are popular and which ones flopped. Also, please share your personal, if you want to, not trying to pressure anyone who doesn't want to share, but I always, respect and truly appreciate people who share their own struggles with me so we can have an open dialogue between the two of us. Now let's get into today's video. First, I want to ask you, how many of you out there have ever, bitten your nails? Or your cuticles? I used to bite my cuticles down till they bleed. I mean, my fingers would be running in blood with it. How many people of you out there have ever picked your skin? How many people have, popped zits continually on their face? They couldn't resist, or blackheads on their nose. How many people of you out there who've got a scab keep picking at it until you pull it off and it starts gushing and bleeding? My son does that too. That's why he never heals when he has a mosquito bite. He'll keep picking at it, at it, and then a scab will form, and then he'll pick at the scab, and you can that's very serious. It can get infected, and it's very serious if you get that kind of infection. But I'm not here to preach or anything. What about pulling your hair? How many of you have pulled strands and strands out of your hair? Okay, this is called body repetitive behavior. This is what body repetitive behavior is about. It's like a compulsive disorder. I have it, so I only like to talk about things, especially ones that, I can tell you, I've personally experienced. It's not so easy talking about something that I haven't been through, because how can I tell you what that feels like if I myself have never been through it? Now, why do we have these body repetitive behaviors? They're like a compulsive, they're a compulsive disorder, okay? Like I did a whole video on obsessive compulsive disorder, but now I'm just talking, honing in on this one area of the body repetitive stuff, okay? Compulsive obsessive disorder has a whole range of things. If you want to, learn more about that and my experience and struggles with that, you can look that up on my channel, because I did that. Now, it's usually, I'm going to talk about, for me, caused by anxiety, okay? We have some anxiety, and doing these, compulsive behaviors kind of self-soothes us, okay? But it also, some of them can hurt us, like, if me picking my cuticles, and they bleed, they can become infected. And an infection, if not treated, can be deadly. It can turn sepsis. Is that the right word I'm saying? Yeah, it goes into your blood, and then you can die from that. So it's not something to be taken lightly. I'm not here to scare you or anything, because I have many of these repetitive, compulsive body behaviors. I have a host of them. I'll talk about what mine are. And, you know, a lot of times we feel very shamed by them. I did too. I was at work one time doing my, biting my cuticles. And, this coworker, who was an idiot, saw me doing it. This young guy, he must have been 20 or something, really young. I was in my 40s. And then he saw me bleeding. He goes, "What are you doing?" And then he said, "Oh my God, your fingers are bleeding. You picking your fingers, you're making them bleed, girl. Why are you crazy? You're crazy. What are you doing?" Not only that, but then he goes around and he tells every single person, "Man, that girl's crazy. Look what she do. You know what she does? She's chewing down her fingers and they're bleeding. I'm telling you, this girl is chewing her fingers down, they're bleeding." That happened to me. So it also, it shames me because now other people, another person saw that behavior that I was doing, and then not only saw it, but didn't keep it, wasn't, kind enough to keep it to themselves. They had to go around and brag and tell the whole Atrium Mall, because I was doing security, just how crazy a girl that, that lady is. Look what she's doing. So, it feels shameful. One time I used to pick, when I was pregnant, I used to pick at my stomach, the hairs on my stomach. I would tweeze them, because women, especially when I was pregnant, I got more hair. Not on my head, but I had hair on my back. I don't know if it was the hormones of pregnancy or whatnot, but I got a lot more hair in places that I didn't like. In the places that men would get hair, not women. And I started picking at it, and then an ingrown hair would, that's when when you cut a hair and then it grows into your skin, so there's a bump, then I'd start picking at that bump. And then by the time I went for my OB-GYN appointment, because you go a lot, when you're pregnant, you go to the doctors, the OB-GYN, a lot. Especially in the later parts of your therapy, in the later parts of your Freudian slip there, of your pregnancy. And, the doctor's looking at me and saying, "What's this all over your stomach?" So it's very shameful for me. Now, please, if you have any of these body repetitive compulsive behaviors, like chewing down your nails, or picking at your cuticles, or pulling out your hair, or, going after your face, or, picking at your scab. And I don't know all of them, I'm just telling you the ones that I do, You might have other ones. Who knows, But please, if you feel comfortable with it, will you share that with me and tell me, does that help you self-soothe? What kind of release? I mean, because it helped me self-soothe. It's hard to explain it to people who don't have those behaviors, because they, like that guy, that other security guard, calling me out on it, saying, "Hey, this lady here is crazy. She's making her fingers bleed," and telling that to everyone. That was really jerky of him, I thought. If I saw someone doing something, I just would keep it to myself. I wouldn't, embarrass the person by spreading it out all over the mall. Anyway, so yeah, I have these compulsive body picking behaviors that, especially like my face, picking my face. I get some sort of like euphoria when I get, like, when I get a zit or something, and it explodes onto the mirror, the contents, all the oils explode. I get some sort of like, euphoric feeling that, I got this, like, fighting, like a war, like I'm going to go in and I'm going to, I'm going to go in and stab this guy, and I'm going to get him and extract him and get everything out of it. They tell you not to do that, but I love doing that. How many people, do you know what? They have a channel. I think it's on the cable. It's probably on YouTube. I think it's on cable or something. The Pimple Popper Doctor. I don't know her name, okay, but they call her, she's a Pimple Popper Doctor. And what she does on that show, and I've seen it a few times, is that's what she does. She pops things, whether they're pimples or cysts or, I have this dead skin. My body doesn't slough off skin. So what happens is I get dead skin cysts. So what it is I'm like a snake. Well, I'm not a snake. No, I'm the opposite of a snake. A snake will slough off its skin, right? People slough off their skin too. When you wash your face, you slough off the old dead skin cells. Well, my body doesn't do that. So what will happen is the skin will collect, instead of exfoliating, it won't exfoliate like normal people. And it will collect and under my skin, and then a cyst of dead skin cells. It's not a pimple, okay? It's different. It's not oil. It's dead skin cells. It doesn't go. I mean, I have popped a few, but it's not like oil that comes out. It's dead skin, so it's white. It's white, but it's not oil. It's dead skin. It's thick. It's very thick. I don't know how to describe it. Maybe like Play-Doh, something like that. Not like oil where it's a liquid. Like a whitehead, when you shoot it out, it's liquid. If I'm grossing you out, that's not the whole point of. I'm sorry. It's not. I'm really sorry. I didn't mean to go that far. Okay, but I'm just trying to, share with you. My experiences, my personal, experiences with the body repetitive compulsive behavior, and what it does for me, and like why I do it, and what I get out of it. And so maybe I went a little too far and been graphic on that. Some people say I go too far. I'm too graphic. They've written reviews on my book saying, that I write very explicit and graphically. But that's just my personality. That's what I do. But anyway, I didn't try to gross you out there. But this is what I do. I don't know if these behaviors are the same thing as like borderlines who cut themselves. I don't know if that's another one, like it falls into that category, because I've never been a cutter, even though I have borderline personality disorder. I've never been a cutter. And I don't, if you have that and you do that, and you're, open, I'm not trying to pressure anyone, and you're open to, share that with me, like what you feel from that. I'd love that. I'd love to have like a dialogue and people tell me their personal struggles and stories. I love that. And I always, try to comment back. I don't just ignore people who comment. I do comment back. But yeah, I mean, maybe does that fall into that same kind of like, compulsive body repetitive, behaviors. But anyway, those are the ones that I do. And, I do have a euphoria feeling from some of those behaviors. And it does, relieve some of my anxiety. Because when you think about it, when you think about someone who chews their nails a lot, usually that you think they're nervous. A nervous person, who's uptight chews their nails. I chew and bite my cuticles. I cut my cuticles with nail clippers. I know salons do that, right? But they don't make you. They when you go get a manicure at a salon, they cut your cuticles, but they don't make them bleed. I used to pick at mine and then leave, you know, what are those things? You have hangnails and all this stuff. But that's my experience with it. Let me know your experience with it. Is there a way to, you know, like stop these behaviors? I mean, I find that, you know, some of the behaviors I don't do as often as I have with other ones, but then new ones develop to replace them, you know? So there's always some sort of body ticking that I'm doing for, you know, anxiety and to self-soothe and relief. All right, that's today's video. Let me know if you have any of these behaviors, how these behaviors, do they help you self-soothe? Do you feel shameful for them? Like when that guy at work told everyone what I was doing. And just let me know. Let's talk. Okay.